Our pathogen project is on typhoid and cholera. Typhoid fever is a bacterial infection, also known as enteric fever. It is caused by Salmonella enterica serotype typhi, which is a gram-negative bacterium, a single rod shaped with flagella. It is a facultative anaerobes and does not form spores, but they persist in the human host, supported by the VI capsule antigen. Route of transmission would be ingestion of contaminated food or water, direct person-to-person contact, especially in environments where hygiene practice is inadequate. Cholera is also a bacterial infection that causes diarrhea. The causative agent is Vibrio cholerae. It is a Vibrio-shaped gram-negative bacterium. They are usually found as a single cells and highly motile. They do not have endospores, but they do have capsules. Route of transmission is contaminated water, raw uncooked meat, crowded areas, poor sanitations, and limited access to clean drinking water. Signs and symptoms for typhoid fever is fever, fatigue, loss of appetite, headache, GI problems, and rose-colored patches. If they are left untreated, typhoid fever can worsen, and complications such as sepsis, GI bleeding, intestinal perforation, which is a hole, they may occur by the third week. Mortality rates for these illnesses ranges from 10 to 20% if they are left untreated. For cholera, dehydration, diarrhea, sunken eyes, decreased urine production, weakness, dizziness, vomiting, and muscle cramps are the signs and symptoms. If they are left untreated, fast dehydration, dangerously low blood pressure, hypovolemic shock, organ failure, and death may occur. Without proper healthcare, mortality rates can rise to 50 to 60%.
So treatment and prevention. Typhoid fever, specific antibiotic treatment are used to reduce the severity and duration of illness, such as ceftriaxone, and erythromycin. Intervention like blood transfusion or surgery may be necessary in severe cases, as Asbutal ETAL 2023 prevention measures include timing, vaccine, sanitation, hygiene, food handling precaution. Rahat ETAL 2023 cholera antibiotic treatment are used such as disocycline, erythromycin, and ceftriaxone. Oral rehydration and intervention fluid prevent ETAL 2021. Prevention measured monitoring outbreaks, ensuring clean water, proper sanitation, hygiene, safe cook handling such as undercooked meat and raw meat, and oral vaccine, Durclaw, Sonjol, and Evaca. So, epidemiology of infection, typhoid fever, major public health concern in the United States in the early 1900s, with over 35,000 cases reported. There are currently about 5,700 situations of typhoid fever in United States a year. During the COVID-19 pandemic, cases decreased even more as a result of sharp decline in foreign travel and improvement in personal cleanliness. Typhoid fever and paratyphoid fever 2024. So typhoid is most common in South Asia, Burma, Cambodia, Philippines, and Thailand, with 306 cases per 100,000 people. In the children among all ages groups are higher risk for typhoid due to their immune system being weaker and consuming contaminated food or water. Typhoid 2023. So for cholera, as of February 2025, 45,731 cholera cases and 491 deaths worldwide reported. So cholera worldwide overview 2024. The top three most cases of cholera are from South Sudan, which is 13,882. Afghanistan would be 9,456, and Yemen is 6,110. Everyone is susceptible to cholera, especially the one exposed to poor sanitation, limited clean water because of cholera is transmitted through the fecal or oral route. Cholera 2022. So a case study, typhoid in Pennsylvania in 1971, 33 people fell ill after going to the church dinner. Contaminated egg salad was suspected. Source, public health official acted quickly in early infection diagnosis. Safe food handling and good sanitation helped to contain the outbreak. The occurrence emphasize the value of prevention of food safety measure and public health surveillance in the preventing the spread of infection caused by food. Cholera on August 7, 2023, in Gage-Joan, Ethiopia. When a male drank contaminated water on the farm while working, he had symptoms of watery diarrhea, vomit, and dehydration, and was confirmed with cholera in his stool. Total of 224 cases from 8/7/2023 to 10/30/2023 were reported thereon. To reduce cholera death, oral vaccine, safe water, hygiene, sanitation was ensured, as well as early diagnosis and treatment.
Interesting fact, some individuals can become chronic carrier of Salmonella enterica serotype typhi even after recovering from the illness. Chronic carrier harbor the bacteria in their gallbladder or biliary tract, setting it intermittently in their feces, which is a significant public health risk. This highlights the importance of identifying and treating carriers to prevent outbreaks. June ATL 2019. So it is caused by Salmonella enterica serotype typhi. Some people become chronic carriers after recovery, and it carries stored bacteria in the gallbladder or biliary tract. So they can save the bacteria in their feces, spreading disease silently. Identifying and treating carriers is important to prevent outbreaks. Some example of public health risks is asymptomatic transmissions. So, cholera. It is closely tied to the environment. The bacteria that causes cholera and Vibrio, called Vibrio cholerae, the love warm, salty water, and often grow near algae. Scientists have found that cholera outbreaks are more likely to happen during certain times of the year, like during the rainy regions. This condition helps the bacteria grow and spread. This helps communities prepare and stop the disease before it becomes a big problem. Givenchy ETL 2011. So, cholera. It is caused by the Vibrio cholera bacteria and found in warm, salty water, often near the algae. Outbreaks more like during the rainy seasons due to the environmental changes. So, linked to poor sanitation and contaminated water. Monitoring weather and water sources can help predict and prevent the outbreaks. Some prevention strategies include clear water, hygiene, and early warning system. So here is the question. What is the cause of typhoid fever, and how does the disease morphology affect its capacity to spread and last within the human body? Number 2. Name 2 key symptoms that distinguish typhoid from cholera. Number 3. Which antibiotic is commonly used for uncomplicated typhoid? Number 4. What bacterium causes cholera? Number 5. What is the most common transmission route for cholera? So, and here's the reference. Thank you.